Hello and welcome. My name is Lucinda Gruber. I'm an endocrinologist at Mayo Clinic in Rochester, Minnesota. I specialize in pituitary and adrenal disease, which means I see patients with adrenal insufficiency almost every day in my clinical practice. Today, I've put together a collection of commonly asked questions that I hear from patients, specifically talking about adrenal insufficiency and adjustments to make with their medication with sickness, travel, exercise, kind of helping people navigate through life with adrenal insufficiency. We're going to start off with just some basics about cortisol and adrenal crisis. Cortisol is a very important hormone. We cannot live without it. I like to think of it as our get up and go hormone. And this is because it's really important for us to feel well. It helps support our energy, appetite, blood pressure, but it also plays an important role in supporting the immune system and heart when we get sick. The body will naturally increase cortisol levels when sickness starts and can produce several times the normal amount of cortisol when we're ill. With adrenal insufficiency, the adrenal glands are not able to produce the normal amount of cortisols that we need to feel good day to day. Hydrocortisone or prednisone help replace the cortisol naturally made in the body. During illness, you'll need to take extra hydrocortisone or prednisone to help support your immune system, which will mimic what the body naturally does to raise cortisol levels with illness. What is an adrenal crisis? This is a life-threatening condition caused by not having enough cortisol in the body. Symptoms can include things like very low blood pressure, nausea, vomiting. Some people will even pass out or lose consciousness. Adrenal crisis can be caused by different things like a severe illness, food poisoning, even something like a surgery. All patients with adrenal insufficiency are at risk for an adrenal crisis. It's very important that you learn different steps you can take to prevent this. There are 4 main steps. It starts with learning how to adjust your medications when you're sick, having access to a rescue injection if needed, wearing a medic alert, and learning how to communicate with different medical providers. We're going to start with adjusting your medication when you are sick. With mild illness, something like a head cold, a sore throat, we recommend increasing the hydrocortisone or prednisone by 50%. Let's say you normally take hydrocortisone 15 milligrams in the morning and 5 milligrams in the afternoon. With a mild illness, you'd take 50% more, so 10 extra milligrams a day. You could spread this out, so you take 20 milligrams in the morning and 10 milligrams in the afternoon. If your normal dose is prednisone 5 milligrams each morning, with mild illness, you'll take 50% more, or 2.5 extra milligrams. So this would be 7.5 milligrams each morning. With more serious illness like a fever, a flu, a bad infection, we recommend doubling the amount of hydrocortisone or prednisone that you would normally take. You can either take the higher dose at the normal times, or you can spread out the total amount over a 24-hour period. To give you another example, let's say your hydrocortisone dose is still 15 milligrams in the morning and 5 milligrams in the afternoon. With serious illness, you're going to take double that amount, or 40 milligrams total. So you could take 30 milligrams of hydrocortisone in the morning and 10 milligrams in the afternoon. Another option would be to take that 40 milligram dose and take it every 6 hours, so 10 milligrams spread out over a 24-hour period. If your normal dose of prednisone is 5 milligrams daily, you can double the dose and take 10 milligrams total. This could be 10 milligrams each morning, or 5 milligrams in the morning and 5 milligrams in the afternoon. So just to recap, with mild illness, we recommend increasing the hydrocortisone or prednisone by 50%. For more serious illness, we recommend doubling the amount of hydrocortisone or prednisone that you take. Now, normally when you're on the higher dose of medication, you take this for a few days until you're feeling better. With a mild cold, you may only take the higher dose for 2 days. With a more serious flu, if you have symptoms for 8 days and you feel unwell, you would stay on the higher dose for those 8 days. Once you're feeling better, you go back to your normal dose. There's no need to gradually decrease the dose. You can simply go back to your normal dose you were taking before you were sick. Do you need to adjust the fludrocortisone with sickness? The long and short answer is no. You do not need to increase or decrease the dose with illness. You can take your normal dose of fludrocortisone while you're taking the higher dose of hydrocortisone or prednisone with sickness. Moving on, we'll spend a little bit of time talking about a rescue injection. So whenever you're sick, it's best if you take a higher dose of oral hydrocortisone or prednisone tablets. The injection is to be used when you're not able to tolerate oral medications. We see this commonly with food poisoning. So someone's vomiting multiple times a day, and they can't be certain if they're keeping their tablet medication down. The injection could also be used if you passed out and a family member or friend is waiting for an emergency help to arrive. They could give you the injection at that time since you're not able to take more medications by mouth. The injection should be given into a large muscle group, such as the thigh or the buttock. Importantly, the injection is only going to provide medication for a short time, so it's important that you seek emergency help. You may need additional medications, hydrocortisone, prednisone. You might need additional testing or treatment for whatever made you sick. So it's very important to go to the emergency room if you're ever sick enough to need the injection. If you don't have a prescription for a rescue injection medication, please talk with your endocrinologist about this. Many of my patients are hesitant or reluctant to use the injection. They're worried that they may use the injection too soon, or maybe they're not as sick as they think they are. Taking the injection too soon really can cause very little harm. But if you wait too long to take the injection, this can increase the risk of an adrenal crisis. I like to think of the injection as a bridge or a safety net that's basically designed to get you safely to the emergency room. If you have more questions about how to give the injection or when to use it, please talk with your provider for more information. Moving on to the medic alert. So why do I need a medic alert? All my family knows I have adrenal insufficiency. A medic alert around the wrist or neck can help alert medical providers that you have adrenal insufficiency. It's important if you're ever in an emergency situation like a car accident, where you or family members may not be able to communicate with medical providers, that they can recognize you have adrenal insufficiency as soon as possible. Wearing a medic alert can decrease the amount of time it takes for you to receive life-saving doses of hydrocortisone or other steroids in an emergency situation. Communicating with other medical providers is also an important part of preventing an adrenal crisis. Most of the time when this comes up, it's in an emergency room or a hospital. It's important to tell your medical providers right away that you have adrenal insufficiency and need higher doses of medication with sickness. Many medical providers are not familiar with adrenal insufficiency or the sick day rules that we've just reviewed. You may need to educate someone who is helping to care for you in an emergency room or hospital about adrenal insufficiency. You or a family member may need to advocate for yourself to get higher doses of medication when you're sick. Your medical providers may also need to contact your endocrinologist for recommendations if they're not familiar with how to treat adrenal insufficiency. Many times, the medications are given intravenously or through an IV to provide more fast action of the medication and the higher doses that are needed with severe illness. In some situations, a higher dose of your normal oral medication may be appropriate. Higher amounts of hydrocortisone and prednisone may also be needed with surgeries or procedures such as a colonoscopy. It's important to talk with your endocrinologist for recommendations on what to do if a situation like this were to arise. So to recap the 4 steps of how to prevent an adrenal crisis, it's important to adjust your medications when you're sick, have a rescue injection on hand for an emergency, wear a medic alert stating that you have adrenal insufficiency, and talking with medical providers so they know you have adrenal insufficiency and may need adjustments to your medication when you're sick. What are other situations where you might need to adjust your dose? For routine dental cleaning, we don't recommend taking extra hydrocortisone or prednisone. However, if you're having a dental procedure like a root canal, you're having a cavity filled, a tooth pulled, you can double your amount of hydrocortisone or prednisone on the day of the procedure. As long as you're feeling fine by the next day, you can go back to your normal dose. How about exercise? You're starting a new Zumba class, you're starting a new type of exercise program. If you're already someone who exercises regularly, you probably don't need to take extra medication. But if you're new to exercise, you may need to increase the amount of hydrocortisone or prednisone for a few weeks. This will allow your body to get used to the new exercise that you're doing, and then you can go back down to your normal dose. Now, the higher dose with exercise might be taking 50% more or taking an extra 5 milligrams of hydrocortisone or 2.5 milligrams of prednisone on the days that you exercise. The amount of medication that you need with exercise can vary a little bit person to person, so it's important to talk with your provider about this. Now, with prolonged exercise, such as training for a marathon, an Ironman competition, going on a dayline hike or cycling event, this is going to put extra stress on your body and you will need additional doses of medication. For hydrocortisone, we recommend an extra 5 milligrams every 3 to 4 hours while you're exercising. For prednisone, we recommend an extra 2.5 milligrams every 8 to 12 hours. Now, importantly, fludrocortisone may need to be adjusted if you're having excessive sweating. So it's really important that if you're starting to train for an event, your endocrinologist is aware and can make recommendations for this. For travel, you may need to take higher amounts of medication. If the trip is under about 6 hours, you may not need to adjust it. But if you're someone who is very stressed with travel, taking a higher dose of medication with travel is recommended. For longer trips where you're traveling more than 6 hours, we recommend taking an additional 5 milligrams of hydrocortisone every 4 to 6 hours throughout the travel day. For prednisone, you can take an extra 2.5 to 5 milligrams over the travel day. With vaccination, you don't need to take a higher dose on the day that you get a vaccine. But if you have any side effects from the vaccine, like muscle pains, chills, fever, you can double your amount of hydrocortisone or prednisone for a couple of days until the side effects go away. Once you're feeling better, you can go back down to your normal dose. This higher dose is usually just needed for 1 to 3 days. Thank you so much for joining me for this discussion today. We talked about adrenal insufficiency and how to adjust your medications when you're sick, traveling, and exercise. You can keep this video for reference if questions come up down the line. Thank you.